Diolch, Llywydd. Trefnydd, can I request a statement from the Cabinet Secretary for Health and Social Care regarding Epilepsy Services? As you know, Epilepsy Action Cymru recently launched their Seizing Change report here at the Senedd. Now, the report makes it very clear that every health board in Wales is failing to meet waiting time guidelines for treatment after a first seizure. And in the case of my own local health board, Hywel University Health Board, some patients are waiting up to 36 weeks to be seen, the longest waiting time on record. Now, Trefnydd, I'm very concerned about these waiting times, and I'm also very concerned that the number of people living with epilepsy in Wales is growing, and yet there is an extreme shortage of neurologists, especially those with a specialist knowledge in epilepsy, and epilepsy specialist nurses as well here in Wales. Therefore, I'd be grateful if we could have a statement on epilepsy services so we can understand what the Welsh Government is doing to address the serious issues highlighted in the Seizing Change report.
Thank you very much, Paul Davis. And Epilepsy Action as a long-standing organisation, respected organisation. And, of course, you have drawn attention to epilepsy services. And, of course, there are pathways, and there's been long-term commitment to those pathways, which, of course, are often multi-professional. So you've raised this issue, and I'm sure it also could form a question to the Cabinet Secretary when he responds in his oral Senedd questions.